everyone. My name is Anupama Vijay. I'm a medical oncology registrar working at the Leicester Royal Infirmary. The title of my poster is Real World Data on First-Line Treatment Options in Metastatic Renal Cell Carcinoma in a Tertiary Center in the UK. So we know that the treatment options or the treatment landscape in metastatic renal cell carcinoma has changed or evolved over the years. And the first line options include IO-IO combination, IO-TKI, or single-agent TKI. So this poster was really looking into what were the clinician's choice and the outcomes in our population. So it was a retrospective study that we conducted on patients who started treatment from 2019 September up until February this year. And we looked at, in addition to the baseline age, gender, we looked at the histology, prior nephrectomy status, and also the lines of treatment that they've had. We also included patients who had treatment as part of the clinical trial in our center as well. We analyzed the data with SPSS version 29. We had a total of 131 patients, and looking at the first line treatment options, our main focus being the progression-free survival on first line and overall survival. We saw that the Ipilimumab Nivolumab combination was the most commonly used treatment choice, which is about 26% in our population, closely followed by Avelumab, Axi, and Pazopanib, which is 25.2%. The other first-line treatment options were Cabozantinib, Sunitinib, and Lenvatinib pembrolizumab, but all of these were less than 15% of our population of patients. The main interesting point to note that, as expected, the worst IMDC score patients had the worst median progression-free survival, which was about 13.7 months. And it was kind of similar in the favorable intermediate group. And we got a significant p-value of less than 0.001. We didn't get a statistically significant overall or progression free survival on the treatment lines, although it was notable to look at the single-agent TKI patients, so the Pazopanib and Sunitinib patients had better performance progression-free survival in our population, about 24 months and 18. I think the main thing I would take home from this study is that out of the 90 patients who progressed on the first line of treatment, only 64%, that is 58 patients, only had or were eligible for second line treatment. And this is very important to note that we need to give them the best treatment options earlier, because there's a significant drop-off rate subsequent lines of treatment. So that was very notable in our study. And we also looked into the second line and third line options that they received, and that's there on the poster that we'll be presenting on the day of the conference. Overall, it was a very small study, but I think the recent multicentric UK audit that was conducted in 2023 also showed that there was a significant dropout rate and the need for using more effective treatments in the first line setting. And we had kind of comparable data. It's important to look that we had very few patients on Lenvatinib pembrolizumab, the IO-TKI combination, and bearing in mind that my data collection only had patients up to February, and I know for the fact that we have patients started on the IO-TKI combination since then. So my future work will be looking at what was their outcome in those set of patients, and also with the new data showing that Ipilimumab and Nivolumab can be considered in the favorable risk as well, is something to look into, although our patient population did not have anyone on favorable risk having Ipilimumab and Nivolumab. So that was my study. My study was supervised by Dr. Ayodele, Dr. Guy Faust, and Dr. Edwina Scott at the Leicester Royal Infirmary. And I would like to thank my fellow colleagues, Dr. Jaisinghe, Dr. R. Subhadya, and Dr. Sharon Sunil for helping with the data. Thank you so much.